excited to welcome expectant parents, couples who are thinking about having a baby, and some brand new parents who've just maybe had a baby to this webinar from not just across the country. We've had registrations not just from the east and the west and the south and north, but we have quite a few international participants as well today, all the way from Europe and the Middle East, and really very happy to have all of you here. So it gives me great pleasure to invite Dr. Sonali, and she is the founder of Birth Basics, which is a platform that supports women through pregnancy, birth, and postpartum. She's an evidence based birth educator, international board certified lactation consultant, and a physical therapist specializing in pelvic health. She has a doctorate and a master's degree from the University of Pittsburgh, the USA. Very thrilled to have you with us, Dr. Sonali. Parenting Matters, which has been working with parents since 2004, is really excited to offer this webinar to expectant parents. It's one of the two exciting offerings for expectant parents from PM this week. One is, of course, the program for expectant and brand new parents, Baby Steps to Parenthood, that Parenting Matters has put together. And really looking forward to hearing from you on today's webinar, Empowered Childbirth, Busting Myths on Labor, Birth, and Breastfeeding. So without much ado, to Dr. Sonali Santanam, participants, y'all can keep your videos on, keep yourselves on mute. Please put your questions in the chat window. Y'all can put your details of, how far along in your pregnancy y'all may be, if y'all are thinking of having a baby, or, if y'all are brand new parents and how old your little one is. Yeah, Sonali, over to you. Thank you.
Thank you so much, everyone, for joining us here today. And thank you, Seema, for the very warm introduction. I have, one of the things I think I would like to add to that is that I'm a mom as well, very importantly, to two wonderful children. So I have a 10-year-old, I have a 5-year-old, and I know what it is like to sit there, being pregnant, starting on this journey, and it's definitely a very beautiful journey. It's also quite a transition. So whether you're a first-time mom or whether you're a second-time mom, whether you're a first-time dad, I don't want to leave dads out. This is definitely, each time there's something new to it. And every pregnancy is absolutely unique. Every birth experience is unique, and definitely every postpartum journey is unique. So with that being said, I'll tell you that, I'm hoping that all of you here are looking at gaining something from this that is going to really contribute to your birth experience. That's what I'm going to talk about most. The preparation leading up to the birth process. What does it involve? What does it take? Why is it even important? And then, of course, we're going to talk about breastfeeding, because the expectation I find is always couples get the message from media, from friends, family, that birth is definitely something to be feared, maybe something that you have to brace yourself for. It's going to be, I don't like to say it, but very often people say it's going to be the worst experience you're ever going to have, the worst kind of pain. But in sharp contrast, parents do have the expectation that as soon as they have the baby in their arms, everything's going to just miraculously change, and it's going to be the most amazing falling in love experience. Well, many times it is. I'm not going to say it isn't, but very often, and more often than not, it does take time for you to really start feeling that connection. And very often breastfeeding, people think that that's what forms the bond between mother and child, but in reality, it is just one of the things. It doesn't mean that, it does contribute in many ways, but it's not the only thing that we are looking for when we talk about this transition. Okay, so that's what the topic of discussion is today on. So before we start getting into anything here today, I am going to take a moment to show you a little video clip. I want to show you this clip because this is the message that we get from the world around us. And this is something that stayed with me as I was preparing for the birth of my first child as well. So I'm going to just take a moment. This was the expectation of birth I had, is what I'm trying to say. Okay, can everybody see my screen? Seema, can you see my screen? Okay. Oh, sorry, 1 second. I think I need to also share my audio, which I didn't do. So if I didn't do that, you will not be able to hear anything. Oh, oops, sorry, I closed the window. Yeah. Okay, all right.
Delivering a baby is one of the most miraculous things a woman's body can do, and also one of the most painful. If you're pregnant, or if you plan to get pregnant soon, you may be wondering what actually happens to your body when you go into labour. Here's what the experts say you should be on the lookout for. Your water breaks. One of the first things that happens when you go into labour is that your water breaks. OBGYN Dr. Sherry Ross shares that this is medically known as spontaneous rupture of membranes. Just like the other parts of the birth process are different for each woman, you will experience your water breaking differently than other women will. According to Dr. Ross, it may be a subtle leak or a big gush when you're...
All right, so that's all I wanted to see from this. And, these are the movies that I watched, if at some point before I got pregnant. And the expectation was that, I'm going to give you guys a moment. Feel free to put into the chat window what you felt emotionally. I know most of you here are probably pregnant, preparing for this journey, moving closer to your due date. So take a moment to think about what emotions that brings up in you. And you'll find, if I break it down for you, you'll find that it's expressions of fear, terror, there is panic, right? Both mom and dad are looking panicked. And it seems like it's a state of emergency. There is some kind of a rush involved. The water breaks, and then everyone's rushing, to the restroom. Everyone's rushing to the restroom. I'm sorry, there's too much noise here. Everyone is rushing to the hospital, and it's not how, it's really not the message we want to give couples who are preparing for this journey. There is no state of emergency when it comes to the process of birth. That's the first biggest takeaway I want to give you in this talk today, because what we're looking at is ensuring that you stay in charge of the process. There is no last minute decision making. This is something that you can really plan for, something you can prepare for. Make calculated decisions even during the birth process. You have enough time to have a conversation, to laugh, to giggle, to chat. And those are the visual messages that I want to give you. It's very important how we define this laboring process. And one of the things that defines labor in medical terminology is unfortunately pains. Okay, we call the process of labor pains. So again, we are giving another message that this is going to be painful and you have to be prepared, right? Honestly, very few women will experience water breaking as the first sign of labor starting. That is something that needs to happen during the process of birth. The amniotic membrane has to open, or I like to say release rather than rupture, because is more gentle. And the amniotic membrane needs to release in order to let the water out so that the baby can ease its way down through the birth passage. But, it takes a very long time, very often, for labor to start, for it to progress, and for you to reach a state where you're actually needing to cope with the contractions, which are sometimes the cause of pain. So, what what I want to say here is labor is not painful from start to finish. When we talk about labor as labor pains, we're automatically giving you the expectation that it's going to be painful. I have couples call me while they're in labor and tell me that, I'm getting these contractions. It feels like waves of pressure, but it's not painful. So does this mean I'm not in labor? No. If you get regular contractions, even if they feel like pressure waves, and that's what is more likely going to feel like, this is exactly what labor feels like. So why should we sit there in the expectation of pain? So words are very powerful. Words are extremely powerful, and they really wire your brain into a certain pattern of thinking. So let's take a look at some of the terminologies. Okay, I'm going to share my screen again with a small, very short presentation that I've managed to put together. Okay. So what are some of the terminologies? Sorry, one second. Oh, okay. All right. So yeah, all right, I don't have that here, sorry. So what are some of the terminologies that we see used in the process of labor and birth? Let's start with labor pains. Instead of labor pains, we like to call them contractions. They are pressure waves in your uterus, okay, which is purposeful. The first P in labor pains is purposeful. There is a reason this is happening. And what is that reason? You want your baby to move out of the birth passage. And this is something we want to welcome. So can we, instead of resisting this feeling of, I'm going to have these contractions, can we welcome them, knowing that they are bringing you closer to the birth of your baby? A lot of labor pain is anticipated. So it's this expectation, this fear, emergency, sense of urgency, being out of control, something that we don't like at all to be in, right? The state of mind. So a lot of this causes an expectation of pain. So this anticipated pain in itself can cause labor to become a painful process. And then you have to understand that labor is the pressure waves that you have in labor, it's intermittent discomfort. It comes and goes. It's not something that is continuous. You have a lot of breaks in between. You have a lot of time to reboot, to re-energize, and then go back in for the next wave. So if you've noticed, I've been using the term wave. Okay, so we like to replace the term pains with maybe contraction. If you like to be, if you like to visualize it as your uterus contracting. But I like to go a little further and call it a wave. So it's like a wave of pressure that comes and goes, and that immediately softens your expectation of the process, right? So now you're not sitting there expecting pain, but you're expecting a wave. And that wave could be initially mild, and then it can pick up intensity, and then it can, at the very end, just before you birth your baby, it will intensify to a point where you need to cope with it. Okay. Another terminology we find being used very often is, I don't know if you have heard of this term, but bloody show. Um, when we use terms like bloody show, when we use terms like water breaking, or water membranes rupturing, they're very harsh terminologies which really create that expectation. It feeds into that state of emergency and panic. But instead, we like to replace these words with terminologies like birth show. So birth show is more soft. It's so much easier to relate with. And then we have um, water breaking, membranes rupturing. How about calling it a release? So it's a sense of release where you let go. Your body releases any tension that it's holding on to and welcomes the baby into the world. So words do make a difference. It's going to wire the way you think about your birth process. It's actually going to shape the experience for you. So when we talk about having an empowered birth, we mean giving you the power. We want to make sure the power stays with you, because I want you to reflect for a second on if you're a patient who is receiving medical care, or are you a woman or a couple that's welcoming a baby. It's very important for you to understand that this is a physiological event in your life. Birth is designed to work, but we have definitely over medicalized the process, and there is a constant sense of, if you don't do this, then there is a risk for your baby involved. But a good way to address that would be to have the knowledge that you need, understand the pros and cons of all the interventions, and really understand when it's necessary and when it's not necessary. Okay, so um, if you look at the role that all of this creates, this fear, stress, I'll let you reflect for a moment on how you feel when you are stressed. If you have a deadline, you know you're not going to make it, what feelings and emotions come up in you? And when we ask this question, you realize that um, you tend to hold a lot of tension. When you might have an increased in heart rate, cold, clammy hands. You might start feeling your ears getting really warm, right? You're tapping your foot on the floor. If you're in a car, you're probably tapping your steering wheel. And this is basically your body's emergency system kicking in. It's telling you that there is something that you need to run away from, right? And this anticipatory fear actually releases real hormones in your body. So unfortunately, whether it is a real threat or a perceived threat, you are going to have an emotional, a physical, actual physical response to it, which is basically release of stress hormones. And in labor, in the birthing room, stress and fear becomes the enemy, because it literally shuts down the process of labor. It takes you out of that position of power and in that position of keeping you in charge. So this is what we call breaking the fear, tension, pain cycle. It's very important to understand that when you hold on to fear, you hold on to tension physically in your muscles. This causes an actual shunting of blood. So the blood from your uterus, which is working really hard to birth your baby, gets shifted towards all the muscles of defense, which is the muscle that will help you run away. But you can't run away in labor, because no matter what you do, you have to keep going till you have the baby, right? I have so many moms tell me that halfway through they were like, oh, this is not what I bargained for, can I just go back to being pregnant now? But yeah, you don't have that option here. So that tension and that fear builds up, and you tend to hold on to tension in your jaw. You'll clench your jaw, clench your shoulders, and that actually literally closes the pelvic floor. So when you hold your pelvic floor really tight, you're essentially not letting your baby ease out of the birth passage. Okay, so this disconnect, these mixed messages that you send your body, is actually going to cause physical pain. So this is one of the main sources of pain in labor. In addition to, of course, your ligament stretching and the pelvis needing to open, this is a very real source of pain and discomfort, which you definitely want to learn to overcome. And again, the best way to overcome it, overcoming fear, how can you control this, right? So think of ways in which you can control this, because fear really disrupts the hormone flow. Oxytocin is the hormone that causes you to go into labor. Now, typically I would ask for a raise of hands, but let me go ahead and do it. How many of you know what oxytocin is? You can just put it in the chat box. It'll be nice to see it later, right? So oxytocin, and I'm hoping you guys know this, is also called the love hormone. It's released in your body when you are physically intimate with someone during intercourse. Okay, it is also released in your body during the process of labor and birth, which is interesting. And it is also released when you breastfeed your baby, right? So what do you need when you breastfeed your baby or when you're physically intimate with someone? You definitely need to feel safe and supported. Okay, there are a lot of disruptors of oxytocin, actually, not just the need to feel safe, supported, not judged, but in fact even things like bright lights or being in the hospital environment where there are nurses who are standing there watching you, strangers walking in and out of the room. All of this can disrupt the hormone surge, the oxytocin response. So this can actually physically cause pain in labor. And it's very important to learn strategies to ensure that you feel safe. And think about how you will feel safe in labor. It's very likely that you will feel safe in your home when the environment is, I mean, I'm not telling you not to go to the hospital. You will go at a certain point in labor, but not at the start of labor. Typically, we ask you to go to the hospital when labor has really picked up. And that's what doctors will also ask you to do. They ask you to come to the hospital when you are halfway through the process, where the active stage has started. And you definitely need a very supportive partner, a partner who knows exactly what to do, how to fall into step. Um, and that's a game changer. Another thing that studies have told us is having a doula or a trained birth professional present with you during the birth process also helps. I mean, not just helps, it actually decreases the risk of a C-section, in fact. So we need to minimize mixed messages that we are giving mom. From one side, we tell her that birth is natural, you need to go with the flow. From the other side, we have this entire medical crew, medical setup. There are other elements which help physically reducing pain and discomfort, which is position of the baby, position of your body in the process of birth, and freedom of movement. Okay, all of these elements work together to physically bring down the pain, the discomfort that you might experience and help you have an empowered birth. Now, in addition to this, few things that are more and even more important is choosing a care provider who is supportive of your wishes. Ensure that they are having a conversation with you, and this is something that you want to decide fairly early on in your pregnancy journey. Understand if they are going to really be supportive of your choices in birth and are aligned with your birth philosophy. It's very important to have a knowledge of the birth process and understanding of all the medical interventions. When are they necessary? When are they not necessary? Can you avoid them? And this definitely is very essential in our system, because very often, uh, there are interventions that happen in the birthing room without consent. But we actually need to make sure that we are, it's called a shared decision making model, where you want to make sure that you understand the pros and the cons of every intervention and then make the decision to go with it or not. And you have to have the confidence to make these decisions, to ask for this kind of care. That's what puts you in charge. So it's a very good idea to attend a childbirth class, to gain this knowledge, to gain this information. A childbirth class that is not biased towards. So I always say have a flexible birth plan, because honestly, I feel that if you go into labor and birth saying, I am not going to take an epidural, I am not going to do medical pain relief, I am going to breathe this baby out, and then you're put in a situation where things don't go as planned, and maybe the baby's position was not optimal, maybe there was something that happened that was out of your control, and really was out of your control, and you ended up needing an epidural or asking for one. You should not feel like you've let your body down. So that is very important, because at the same time, you don't want to set yourself up for failure by saying that I am going to take the I'm not going to take the epidural and then end up having to take it, or even saying that I'm definitely taking the epidural, because maybe your body is not going to experience labor like you expect it to. Maybe it'll be very a beautiful, easy process, and you don't need that at all. So this is very important, because how labor and birth goes, if it goes according to your expectations, and if it goes according to a benchmark that you have set for yourself, it has to be a realistic benchmark. It does impact the way you experience your postpartum. So birth trauma, where you hold on to these experiences physically, to whether your wishes, whether your requests were respected during the birth process, or were they dismissed, were they treated with respect and with logical decision making approach. Did you feel that you were supported not only by your medical team but also by your partner? And the environment in the birthing room, all of this makes a big difference to how you carry that experience in your body in the postpartum. And when things don't go according to plan, if we didn't have a backup plan, it is actually a risk factor for postpartum depression. We know that, and we want to avoid that. So to summarize everything about the laboring process, the birth process, it's very important to prepare your mind, your body, both physically and emotionally. Make sure that you have um, not only attended a birthing class, but also exercised through your pregnancy, had an evidence-based approach to how you're using all the knowledge that you're gaining in your pregnancy. Now let's talk about breastfeeding. Um, Now this is the expectation we have. As soon as the baby is born, we're going to have our hair in place, and you're sitting on a clean bed. You have this baby, you're cuddling, and I will tell you, I really did think that would be the case. I was very naive back then, clearly, but I thought I was so maternal, and it was going to be the most amazing. How could you not love a baby? And it's your baby. But when I held my baby for the first time, I was actually, I didn't feel anything. I felt a little disconnected because I was still recovering from my birth, and my body was exhausted. My mind was confused. I was also a little upset that everybody else got to see the baby before me. The attention very quickly shifts to the baby. And no one's taking, I don't want to say no one's taking care of the mom anymore, but yes, you do feel a sudden shift. And the reality actually is, I'm not able to move my cursor. Oh, I think my mouse is dead. Okay, the reality is actually this. Okay, so this is something that you want to be very realistic about, because, sorry, 1 second. Okay, I seem to have a problem with my mouse, so I'm just going to leave it. Seema, is there any way in which you can stop my screen sharing? Can you actively stop it so that I'm just on the spotlight?
Sure, let me check.
Yeah. Otherwise, I'll have to just run and get another. It's a wireless mouse. Okay, Ashwin, can you give me that mouse to plug in? It's on Sahana's desk, the wired mouse. Yeah. Okay, you were able to do it? Yeah,
Yeah,
Seema,
yeah.
you could. It's okay, Ashwin. Yeah. Thank you so much. Sorry about that. So it's okay. We don't need the presentation for this. But yes, breastfeeding is, it's a beautiful journey. It's definitely what you think it is. It does help with bonding. It does help with connection, but it's not the only thing. It takes time. And especially a first time mom. Being a first time mom is the biggest risk factor for difficulties with breastfeeding. All the first time mommers here, I just want you to be aware of that it's not you, and it's not that you're not able to cope with it. The reality is that breastfeeding is hard because there are so many questions you have around it. You're not sure if your body is nourishing the baby enough, and unfortunately, everyone around adds to that fear by there's this continuation of fear again in the postpartum, where you're constantly wondering whether the supply is enough for the baby. You're worried that you're starving your baby. You've heard of somebody else's story. So again, you need to make sure that you have very concrete guidelines around what to expect, how much milk is really being transferred to the baby, how much milk you're really making. And another thing I want to prepare you for is the possibility that in the early days, breastfeeding could be painful. So it's not such a smooth transition. It takes time for your body to also adjust to the process. And when you're in pain, again, it's going to cut through that oxytocin response. Oxytocin is what helps you, gives you that falling in love experience, right? So stress in the postpartum does not support, again, the process of breastfeeding and ensuring that you have that connection and that bond. um, when Again, when it comes to breastfeeding, it's very important to have a realistic expectation. The baby feeds every 2 hours. Each feed lasts for 45 minutes, and this goes round the clock. So this is the simplest thing for you to understand. I have had moms who I have seen at the bedside as a lactation consultant, and they've not attended an antenatal breastfeeding class. They would immediately say, um, the baby's feeding every 2 hours. And I'll say, yes, that's how it is. And it's taking really long. It takes 45 minutes. And then I'm like, yeah, it's normal for the baby, because their mouth is so small. It takes them time to suckle. It takes them time to really transfer the milk. And like, but they're feeding at night also, but the baby is going to feed round the clock. Okay. Because when the baby was in the womb, your placenta was nourishing the baby round the clock. Now that the baby is out, nothing changes. Now it's going to be a little harder because you have to physically do it, which means no sleep for a new mom, right? If you ever tell a new mom, and this is true up until the age of 3 or 4, I think, but if you ever tell a mom that, get some rest, she'll probably laugh out loud. And it's very important to have this expectation in place, so that it doesn't come to you as a shock or as a big surprise once the baby's here. So get self-care strategies in place even before you have the baby. Think about who's going to be on your speed dial, right? You want to make sure that you have a support team in place. You definitely want to start with family, with friends. Do you have someone who can watch the baby when you get some rest? Or um, I really like to have moms create or write down a list of things that defines who they are, things that they like, that they enjoy doing in the day, in a 24-hour period. Is it your 20-minute shower? Or is it that meal that you sit with your partner and enjoy? Or is it a walk that you take in the evening and you've been enjoying that for a while? So you could have a list of just 2 or 3 things that really help you feel sane and normal and feel like your life hasn't changed too much, and definitely find a way to fit it in. So that's one thing that really makes it much easier to transition into that postpartum. Because if you look at the clock, there are some things that will have to be put on a hold, like maybe getting out or meeting with friends or watching a movie. But then there are other things that you can definitely do, and these things will define your sanity. You can have a postpartum community, like a group of moms who are breastfeeding together, and that makes a lot of difference, having that connection with all of them. Yeah. All right. So that's a little bit about staying in charge of the process, making sure that you have a team aligned. And also, of course, I want to mention that I spoke about family and friends, but also the medical team. You want to have a lactation consultant who can see you in the postpartum. This is a service that is not often offered at all hospitals, but you actually can even get a virtual consult. Like, I am doing virtual consults right now at the bedside, and it makes such a big difference. I wonder why we never did it before. There's a lot of delays. People are very hesitant to do virtual lactation consults, but actually speaking, it's great because there used to be a lot of delays going in to see the mother. If I go at the time that's convenient to me, the baby might be sleeping. It turns into a wasted visit. Then we have to come back again at another time. Especially since you don't have lactation consultants attached to the hospitals, very often here, at least in India. I'm sure it's different in other countries. But getting a bedside consultation is very important, followed with follow-ups to make sure that your supply is good, to make sure that you have enough confidence in your supply. There are growth spurts, there are leap days where the baby is growing at such a rapid rate that the sleep for those days goes out of the window. You have no time to even eat, right? And this is a time when a mom is constantly worried, dad is constantly worried, is the supply enough? Should we supplement with formula? And typically there are guidelines around this. We have like very clear check marks on whether it's necessary, whether it's not necessary. And once you know that, you're definitely more confident about the choices you've made. So you won't feel guilt. You won't feel any of those things that, really dampen the effect of becoming a new parent. All right. So I will stop with that right now because I can keep going on. And I'm hoping that that was a good introduction to some of the, uh, yeah, some of the expectations around birth and breastfeeding. Yeah.
Thank you so much, Sonali. Your passion for the subject and for what you do just shines through when you talk about it. I can literally see your eyes light up as you're sharing with expectant couples. And as a mom of two myself, who are now almost 9 and 11, I have this little pang of regret. Oh, I wish I knew all this. And in fact, I'd like to start with that question from one of our participants. And they want to know, where can they attend a childbirth class to, so that they get a really good understanding of the entire process so they can avoid this panic.
Okay.
And I
Well,
know you do like fabulous stuff right from, the pregnancy stage onwards. So please do share with them.
yeah, so that's a good question, especially now with the pandemic, because we're not doing any childbirth classes are usually group classes. So it's nicer as a group actually, because you have the interaction, you're learning from everybody's experience in class. And because of the pandemic, of course, there are no in-person childbirth classes happening, but we are doing everything virtually. So every month or every other month, we have a new group that comes together. um, I do teach the yogic birth approach, which is understanding the process of birth through concepts of yoga to prepare your body, to prepare your mind, and to also use harness that energy in birth to empower the birth process. And I also teach hypnobirthing. So there are two different approaches that I teach when it comes to empowering yourself. Hypnobirthing is a very interesting approach because it works on really calming down your mind and body, making sure that you're eliminating fear through the use of hypnosis. And it's self-hypnosis. It's a very, very effective and powerful tool. It's definitely something that has a lot of scientific evidence to back it as well, as a tool that works in the laboring room. Yeah.
Thank you, Sonali. We will be sharing Sonali's details in the chat box. You all can reach out to her. She does some fabulous work. You can check it out on her website. And Sonali, you mentioned hypnobirthing, and we have a question about that from a participant who really wants to know more about it. Will she find information about it on your website, or would you like to share a little bit more here?
A lot of what I talked about in my introduction, I mean, see, honestly, any approach to childbirth education is going to talk about, eliminating fear, making sure that, you are empowered with knowledge. But hypnobirthing is one approach that really, it bases everything on these concepts. on changing the vocabulary around birth, making sure we rewire your brain to have a different expectation, um, guided visualizations to help you realize that expectation. So you're constantly bombarding your nervous system with positive images, with positive um, outcomes, expectations of positive outcomes. And that in turn actually really, makes a huge difference in how your cells, literally the cellular memory about birth changes. And that's a very, very effective and powerful approach. So we also do a fear release to let go of any fears around the birth process. Some people have fears around parenting, and if you're holding on to those fears, it's possible that that itself will prevent the birth process from starting or progressing. So, hypnobirthing really works from more of a mind and body connection, which is very similar to yoga. The biggest difference is in hypnosis, we do a lot of suggestions and we suggest that you feel in a certain way. In yoga, we give you the freedom to feel what you want to feel.
Thank you, Sonali. Um, we have another question from an expectant parent who asks how they can cope with water breaking, or as you so beautifully called it, the release of fluid when they are in public, if it so happens.
Yeah, so this is actually not very common, like I said, it's very rare. But if it did happen the way you saw in the videos, it, there are two ways in which a water can, there are two ways in which the membrane can release. It can either be a trickle down your leg, or it can be a sudden rupture with all the water gushing out. It's more common for it to be a trickle down the leg. If it's a gush, then yes, you will have to go to the hospital right away, because labor usually follows soon after. Um, and of course, they'll still wait for the process to progress on its own. If it's a slow trickle down the leg, then you can relax around this a little bit more. You can take your time and but in both cases, you will get to the hospital before labor starts, because once the water breaks, then you're monitored, and you can still wait up to 24 hours to actually medically induce labor. But you will unfortunately be in the hospital setup while you're waiting for labor to start on its own, which in itself is a problem sometimes, because when you're in that medical setup with harsh lights, it can shut down the process. So then you have to think of strategies to soften that experience, like dim the lights in the room, feel confident to do things like that. You don't have to sit with the lights bright. You can ask people to give you privacy. Cover, I always, like in hypnobirthing, we tell moms to we tell couples to cover the clock. So you're not constantly checking time to see how much time has passed. Just another thing with hypnobirthing is this whole time distortion. You're just relaxing to a point where you don't realize how the time's passing. Yeah.
Our next question is about a doula. You mentioned about having a doula really, really aiding the birth process. And they're asking, when do we ask for a doula? Do we ask when we're admitted, or can we do this in advance?
This is definitely something that you do ahead, because you have to build a bond and a relationship with a doula. If a doula comes into your birthing room when you're in the process of birth, she's a stranger, and that is going to not help. It's as good as somebody, that you like, one of the nurses supporting you at that point. So you will meet a doula ahead of time. There are a set of questions that you want to ask your doula to make sure she is again aligned with the way you feel and think. There would be a couple of, at least 2 or 3 visits where you talk and discuss and develop a rapport, so that you're learning to relax around each other. And yeah, so you definitely plan ahead. There are hospitals, so this is another thing, choosing your care provider. So there are hospitals that are supportive of a doula being present in India, and then there are hospitals that don't understand the concept, or doctors who don't understand the concept. So if you're looking at having a doula in the birthing room, which is a very, very powerful tool for you in labor and births, it's important for you to also plan around your care provider. Yeah.
So, Sonali, as a follow-up, I would like to ask, is there some place where these resources are available on hospital websites?
Can you explain that to me? Sorry, is there a place where?
So you would So, for example, you're talking about doulas, and some hospitals providing it and some not. And there might be doulas who work privately, and maybe you could ask them to join you, during the birthing process. So, is there some website or resource that you might be able to provide to parents where they can actually seek this service out, or is this available on hospital websites?
Well, you can. I mean, there is some information available on my website on which hospitals do have these services and which ones don't. But also, um, there is Informed Birthing India, which is a Facebook group, which would be a good resource because you would have a lot of women there who birthed at different hospitals and had different experiences. So it's worth, asking over there on to make sure that you have someone who's really supportive. Yeah.
Thank you, Sonali. I have typed in the name of this Facebook page that Sonali has mentioned. It's called Informed Birthing India, and we have another suggestion called Plus One to join the. Oh, so they are recommending it along with you. Brilliant. Um, Sonali, the reality is in a lot of places, we have doctors just telling you what they're going to do and not really giving you much choice. So, what are the choices that we can realistically expect? And what can we do to remain calm during the birthing process, which seems to be so, so important from what you're saying?
So it's definitely knowledge. Knowledge is power. If you know exactly what to expect, what happens one after the other, how your emotions are going to change through the birth process, what happens at the end of it, where it will pick up intensity at one point. You are expecting this. How are you going to cope? So practice is key. Making sure that you and your partner learn these techniques ahead of time. I would say the third trimester, the start of the third trimester, 28th week, even sooner, 22nd week and up would be a great time point to join a childbirth education class. Once you have all this knowledge and information, put in a steady practice plan so that you are consistently in touch with the techniques, because just knowing the techniques is not enough. When you're in the labor and birth process, to be able to respond to your partner's cues, to be able to respond to his instructions and commands, you have to have done it before. That trust has to have come even between the two of you. And it's very common for some, like, we hear this all the time, where dad's very concerned, and he might say, are you okay, can I do something to help? That's an open-ended question. That's a question that will throw you out of the birthing room, right? So mom gets really upset because she's like, there are so many things you can do to help me right now, but that question doesn't help at all, because you have to be very close-ended, very specific. Do you want to change positions? Shall we change the breathing pattern? Can I give you some water? And these are the things that help you stay calm and in control. And when it comes to asking the doctor for the right kind of care, this is something that you need to do early on. When you're building your rapport with your doctor, you have to interview them, to ask them about their biases. Like, are they biased towards medical interventions in labor and birth, or are they supportive of natural birth choices, where you definitely want to wait for labor to start on its own, unless there's a medical indication. But typically we look at due dates as expiration dates. Okay, so as soon as the due date is reached, something has to happen. But it's an estimate. It's called an estimated due date for a reason. And it basically puts you in a 4-week window, anywhere from 37 till the 42nd week. So we can wait. So there are many reasons why birth doesn't go as planned. If you reach the due date, you're medically induced, your body is not ready for it, this definitely amplifies your risk for a C-section. So, it's not just about having the knowledge, it's about knowing how to apply it, knowing how to make these decisions in an informed way.
And that is such an empowering message you've given, that you need to interview your doctors. It's not something we really think. It's gospel what the doctor tells you, because you don't know unless you're a medical professional yourself. You might, and it's your first time, it can be so overwhelming, the whole experience. And this is so powerful to say that please interview your doctors to really understand what their way of doing it is. And in line with that, Sonali, what are some of the questions that we should be asking gynecs? You did mention about talking to them about their biases, but are there any other questions that you would highly recommend that expectant couples ask their gynecologist?
Okay, so your question is, what are some of the questions that they should be asking?
Yeah.
Okay. So the top three, I would say, is um, what is their birth philosophy, like how do they approach. So it's, I always like asking open-ended questions. So what at what point should I be coming to the hospital once I'm in labor? That's a great question to get to know where their biases lie. Okay, so if you've attended a childbirth class, you will know that you should be going to the hospital only when your labor has reached the active phase. Okay, which means that you're spending most of the laboring process at home. Um, you don't go to the hospital at the first sign of labor. But if you are told that please come at the first sign of labor, as soon as you see birth show, or as soon as you see, pre-labor contractions, please come in right then you know that this is going to be someone who's going to be using a lot of interventions. Another question that I would definitely ask is, so what happens if I reach my due date and I haven't gone into labor? This is a very, very important question to ask, because this is actually one of the main reasons why a lot of births don't go as planned. So if your body is not ready for the laboring process, it's not ready. Yeah, no amount of priming it with hormones is going to change that. And anyway, it's very interesting to think about this, because it's your baby who decides when it's time to come. It's not your body. So this whole chain of events that is put into action is, it starts with the baby's lungs maturing. So once the baby's lungs are fully mature, once your baby takes, is able to take its first breath technically out of the womb, uh, the lungs release surfactant into the amniotic fluid, which tells your body it's time to go into labor. And that is what triggers the laboring response. Now, clearly, if your body hasn't got the message, the baby is not ready. And the American College of Gynecologists recommend waiting up to 42 weeks. 2 weeks past the due date that is given to you, which is clearly an estimate. For I don't like to use the word allow, because that's a right that you have, for having labor to start on its own. Now, there are some small risks associated with waiting past the due date, but you can keep track of baby movements. You can even go in for checking on the baby using a Doppler, or just a CTG, to make sure that there are no dangers with going over the due date. But these risks are only greater 42 weeks and up, which is called post-term. So 37 to 42 week is called term, full term. It's only after 42 weeks where the definition changes to post-term. So, clearly you should be waiting at least 2 weeks past the due date. So when you are told otherwise, you know that, this is definitely going to be not aligned with your birth plan, if that's what you want. Yeah. Again, Seema, I'll tell you, and I'll tell everybody here, it's if that's what you want, you have to understand what your medical mind is. There are people who are very distrustful of the medical system, and they don't want interventions at all. They absolutely want to go as natural as possible. And that's your philosophy. But if you are someone who knows the pros and cons and still takes the decision to go down a certain route, again, that is your choice. But what is very important is you are informed of your choice. You are informed of your pros and cons. These are the real risks involved, and these are the real benefits involved. You have to weigh them and make a decision for yourself.
Absolutely. Dr. Sonali, we are close to 9 o'clock. I was wondering if you would be okay taking a couple or two or three more questions, or I leave the choice to you how you'd like to proceed.
Thank you so much for putting it so nicely, Seema. Of course, I'm happy to take more questions.
Thank you, Sonali. Um, So this question is to do with breastfeeding, and the participant asked, "Will the baby let you know if the supply of milk is less, and how? And when does milk start coming in? Is it immediately post delivery, or can it happen any time in the days before or after delivery? Is there something a mother can do or should do to start the process?"
Okay. So, first of all, you don't have milk in the first 5 days postpartum. You can say that loud 5 times. You just don't have milk. And there's nothing to be scared about when it comes to that. Your body is making colostrum. It looks like a serum. It is sticky. It looks exactly like the serum that you get in those little glass jars. Okay. It is sticky. It is full of antibodies. And it is the only thing your baby is going to need in the early days postpartum. Okay. It is I like what a doctor actually once put it as, and I use it very often. It is sufficient for the baby, but it may not satisfy the baby. So, what happens is the baby is constantly asking for milk in the early days. And this is not a sign that you don't have milk, it's just a sign that your baby is trying to kickstart the milk production in your body. Okay, so this frequent stimulation at the breast is also essential to ensure that your milk comes in adequate quantities. So, what happens in the early days after birth is a process of calibration where your body is trying to judge how much milk this baby is going to need, not just for the next 2 days, but for the next 6 months. So it basically establishes your breast making capacity. And this happens in the very early days postpartum. So, yes, if you have, for example, gestational diabetes through your pregnancy, then this is one reason to try and kickstart this process sooner. Um, Babies of moms who have gestational diabetes tend to develop hypoglycemia, which is a low blood sugar levels as they get into their in the early days. They're very sleepy, they don't wake to feed often, and that could put them at risk for hypoglycemia, which becomes a reason for medically intervening and giving formula to this baby, okay, to give supplements. But we can troubleshoot over there by pumping early. So within the first 6 hours, we should start pumping. And this is again not this. This is a big problem. Um, Lactation consultants will tell you to pump early because they have this knowledge and understanding. They are trained. They know the research behind why they are making these suggestions. But unfortunately, this information is very new knowledge, which hasn't yet trickled down into clinical practice. So at the bedside, you have a lactation consultant saying pump, and then you have a doctor saying, don't pump. Why are you pumping? You will have too much milk by day 3, day 4. But, that's something that we can manage too if it happens. But the risk of having enough is more than the risk of having too much a few days later, especially in this case. So it's very important for the whole medical team to be aligned and give the same message to the mother, and then have the same message come from family and friends as well. Yeah.
Thank you, Sonali. There's another question around breastfeeding, and they ask, how can the nipples be prepared to help the child suckle easily? And how can they ensure that they're able to maintain a milk supply for up to 24 months of the child's age?
Okay. Great question. So, there is nothing you need to do to prepare the nipples before birth, before you give birth. There would definitely be a need to assess and know if the baby has flat, the mother has flat nipples or inverted nipples. Okay, so this is a very important checkpoint. And if the baby if the baby is able to latch on well, even though there is a flat nipple, we don't encourage use of any kind of nipple shields or anything unless absolutely medically necessary. So if we do have nipples which are flat or completely inverted, not able to evert it, that's the only case in which we would work on it before the baby comes to help prepare it. To some extent, that too. And in the postpartum, and you can even start pumping actually in the last 4 weeks of your pregnancy to kind of stimulate milk production and to make sure that the nipples come out a bit. It's perfectly fine to do so. That's another guideline that, you know, is not widely supported because of lack of information around it. And outside of that, there's nothing that you would do to prepare. How do you ensure that you have enough supply for at least 24 months? Um, Immediate skin to skin contact after birth. So baby's out of the womb, baby's on the mother's breast, directly in contact with her skin, not with her hospital gown. Okay, there's a big difference. This stimulates the body. It tells the body the baby is here, the baby is ready to feed, the baby wants milk. It's a powerful message to give your body. Then you have breastfeed within the first hour. This is the golden hour. This is the time where the baby is most alert, really wanting to suckle, actively rooting for the breast. We definitely want to make sure that your baby is latched on within the first hour. There are delays at the hospital sometimes because the mother and baby are separated. But unless there is a medical reason for this, it is absolutely harmful practice. It's not just something that should be avoided. This is harmful to the mother and baby. We call them a dyad, which means they're treated as one person for the next 3 months. Okay, after birth, we should never separate mother and baby. That also plays a big role. And the third thing, so it's interesting how what happens with it immediately after birth, within the first hour, and in the first 2 months, the impact that plays on your milk production for the next 2 years. Okay, so moms call me and say, what can I eat? I'm eating everything. I'm not able to make milk. No matter what you eat, you won't make milk unless you have a baby who's actively suckling at the breast, asking for it. Okay, so I'm not a lactating mother right now. If I eat, methi, if I eat, supplements, I'm not going to miraculously make milk unless I have a baby who's asking for the milk, or if I have a pump at the breast, that would also help. So yes, when it comes to making milk, it's all about demand, which creates the supply. In addition to that, stimulation in the early days, immediately after birth, in the first hour, feeding on demand in the first 2 months without supplementing, especially when the baby has growth spurts, which are leap days. Baby is growing at such an active rate, such an active pace that moms are constantly doubting their milk supply. And instead of that, you want to reassure her, give her very objective measures to measure. What goes in comes out. If your baby is peeing enough, your baby is likely to be getting enough. I cannot tell you. I have couples call me saying, baby's crying all night. I cannot do this anymore. I really, please do something. I'm losing my mind. And then I'm convinced that there is no milk. Help me improve my milk production. And then we just ask them a few questions. And the first question I would ask is, what's the urine output? And they say, oh yeah, baby peed about 20 times yesterday. Then, that's the milk. That's your milk. And there is no need to supplement, because supplementation is not the answer in this case. Sometimes it makes things worse. Okay.
Thank you so much, Dr. Sonali, for answering all of our questions so patiently and in such detail. And I would highly encourage participants here to reach out to Dr. Sonali if you have any more questions, you want to find out more about the work she does and how she supports expectant couples right through pregnancy to postpartum. Please do reach out to her. We have shared her details in the chat box. And it was such an incredible start with you really giving all of us such a reality check about this La La Land scenario that's created for us, and then we end up feeling and beating ourselves up because we're not feeling that way. And from that to reassuring that childbirth is not a state of emergency, and you can be in charge throughout your birth. It's such powerful messages. Dr. Sonali has spoken to us today about how important it is to break the fear, tension, and pain cycle, and how it's really important that you create a birthing environment where your body is constantly, releasing oxytocin, the love hormone, the happy hormone, so that it keeps the process of labor on. Um, Breastfeeding, we live in a country where we are supported by family, and there's a lot of beautiful traditional knowledge out there, and having this additional knowledge of realistically knowing what to expect from your body, from your baby, and all of that, in terms of breastfeeding is again so invaluable in knowing whether, in that time where you're so overwhelmed with so many emotions, your hormones are playing havoc, to really know that you are on the right track. Um, really want to highlight the importance of self-care strategies that Dr. Sonali shared, and how important it is to put in place and to really figure out who your support group is, who's going to be your postpartum community. Please go and ask your doctor all those questions that she suggested you ask them, and make an empowered decision. And finally, I think today's webinar was so correctly titled Empowered Birth, because I think even in this short session of, it's been just over an hour, it's incredibly empowering to have even, just scratching the surface. And I can imagine the sense of confidence these expectant parents will go into this beautiful process with. I mean, most of you here are either on the threshold or experiencing this milestone moment of expecting a baby. And Dr. Sonali Santhanam's, what she shared with us today, I think has just been absolutely fantastic. Thank you so much, Dr. Sonali Santhanam, for joining us today. Please, can I request you to join me in a breakout room? And while we do that, I'd like to share with our participants that, the whole aspect of having a baby often brings up a lot of anxiety around parenting as well. And Parenting Matters, which has been working with parents since 2004, has curated and put together a workshop for expectant and brand new parents. It's a 3-session workshop, and y'all can reach out to us to find out more about it. So while Dr. Sonali really gives a very excellent sense of how it works in the physical and the emotional realm in that sense, this session will deal with all about how we can prepare ourselves for parenting the little one we are about to welcome into our lives. So thank you so much, everyone, for joining us today. And if you all have any more questions about either today's webinar or the program that we are sharing on the screen right now, you can put it into the chat box. One of my colleagues here will be more than happy to help you with your questions. Thank you so much, all of you, for taking this time out on a Saturday evening and joining us.